Action.
Oh my gosh, where am I supposed to write?
I don't know.
Where's my book?
That's your problem.
Put it right there. What's up? Put it right there.
Because they plugged up.
They got it to the electric.
They got it to the electric.
Yeah, I want this right there.
No, here. The bottom part. No place on charger, so
Doop, doop,
oh yeah, I'm put my phone on.
doop, doop. This thing is coming out.
What the ports, right?
All right, now. Yeah.
Ready, go.
Action.
I can talk now?
Let me check.
All right, the abbreviation that you're going to see anywhere else is just trying to help you to remember what we're referring to when we talk about RAP and MBC. So these are the terms that we know in-house. They're not terms that are out there or abbreviation that is out there.
Stop
When we
shaking
talk
this
about
thing.
RAP in this section,
For Christ's sake.
what are we referring to?
Red,
And positive. So just to keep that in mind, that's what we're looking at. Red, anode, and positive. And then NBC, not the television station. But NBC is
Negative.
black,
Cathode.
Good. Okay. However, EMG is what?
Myogram.
And then ETR is what we had in class. What is ETR? Uh-oh. Page 22. ETR and EMR, page 22. Page 22 is enhancement of tissue repair method. Okay. And then enhancement of muscle re-education. And you can read those on your own as to what they do and all that, but just know there. DJD. Degenerative joint. Let's see where that's sitting. I think that is on page 9. Page 9. And it's some of the indications, one of the indications for track. Page 9. All right, men's. The lecture for men's is on page 22. And it has two names for men's. Minimal electrical non-invasive stimulation or
Micro currents, neuromuscular.
Electrical neuromuscular.
So there's another that has two names. Electrical, that's correct. All right, T wave. T stands for what in this segment that we're talking about? Tsunami. All right, so tsunami meaning what as far as what's happening?
Disaster.
Alternating between positive and negative. Good. That square wave. Good. Again, we're just looking at abbreviations that's in this segment for this particular test. SKTC.
Single
needed
needle chest.
Good. And then DKTC.
Double needle
chest. Good. LBP.
Low back pain.
Low back pain. Good. And then NRI. Nerve root impingement. Good. About all I found basically for this particular segment. All right, Ionto. What is it?
Is that electrical?
So electrical current is pushing a medication. An ion through to the skin. So Ionto is starts on page 1. So again, when you're looking at this, if you need to refer to certain pages in the book, it's good to write the page numbers down so when you start studying those, you can do that. All right, what patients should feel?
Nothing.
Tingling. Not irritation. Mild tingling. Good. All right, so what should they not feel? Increased pain, irritation, sort of burning, something like that. Why is it that they might feel it?
If they move.
The number one issue usually is dirt.
Okay.
Or broken skin. So be mindful of broken skin. Because you're pushing the dirt in the body.
I have a question.
Yes.
At the beginning of the course, I
Oh, you don't want the itchy.
no.
Well, you might feel a
No.
little bit, but you don't want that burning.
So the answer is
Tingle. Mild tingle. How do you prep the skin prior to the treatment of Ionto? Alcohol. Permastone.
No.
They said no.
Did that went to
Aha,
another?
yeah. So alcohol, wipe it down real good. Now, what if a person has hair? What is the best that we can do?
Scissors.
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 Yeah, that's where the difference between different grades come in. That's the switching between one you can do it for and one you can't do it for. That's what you want to make sure you have. All right, and we already talked about why intact skin is needed or not. All right, how do you misuse Ionto?
Ultrasound.
Misuse refers to the fact that you can use it, but you're doing something wrongly to alternate the usage of it. So that's talking about ultrasound, hydrotherapy, hot pack, heat stem, vigorous exercises. Yeah, so you're doing something you had no business doing, but had you not did those, you would have been fine. Okay. What's some contras of Ionto? Page 2.
Demand pacemaker.
Pacemaker. Broken skin. Good.
Chronic.
Allergic to the medication. Good.
Chronic pain.
Blood clot.
All right, let's see. Dexamethasone. Stop. Now, let's go back to the medications at the top. What works well with dexamethasone?
NBC.
So, negative, black, cathode.
Inflammation.
Now, what else do we know about dexamethasone?
Anti-inflammatory.
Inflammatory. What kind of drug is it?
Corticosteroid.
Corticosteroid. How deep does it go?
1.7 centimeters.
So put that all together. Put that all together. It'd probably be good just as a review, so we don't have to go over that much of it now. We just put the quiz with this. You know, any quiz, because the quiz got a lot of that stuff already on it. Okay, lidocaine, back at the top. Rat. Red. Anode. Positive. What else?
Pain relief.
Pain relief. Good.
6 centimeters.
Good. All right. Good. There we go. All right. So, application method or treatment. So, I'm treating lateral epicondylitis. I need to clean the skin. How?
With
Alcohol. Good. I've cleaned it off really good. I cut any extra hair that's around. That's the best I can do. I put what type of electrode here? The active electrode. How do I know it's active?
Of the silver.
No, the
The
race.
metal is
It's on the side of truth.
it's with the medication.
It's the one that has the medication. That's
Oh,
how
okay.
All right, and then the disperser goes where?
4 to 6
Forward major
inches.
way.
All right, so can I put a disperser right here?
No way.
Why
No.
not?
It's working.
I'm holding my arm there. I mean, why is the pressure?
No
You
way.
press
You put it down in the
When I put it down, then I can. Good. All right, good. All right, so dexamethasone, we said. What lead am I going to put on the
black.
The black, and then the red one's going to go there. Good. I can only stay for 10 minutes. How many milliamps will I need?
40. Oh.
40. So I'm going to feel more or less?
More.
More.
4 per minute, right?
No.
40 total.
40
40
anyway.
10 minutes.
Yes, but I can only stay. Okay, good. So that was the milliamp treatment. Huh? You all can figure that out. So if you do you know you want to give them 40 milliamp minutes overall total. If you only give them 1 milliamp times what equals 40 milliamps?
40 minutes.
4. So just do your math there. You know how to go back to that. No reason for us to do that. All right, biofeedback. What is it? Biofeedback. What is it? Page 7, by the way.
Giving feedback.
Giving feedback.
Way of giving
Patient.
So it measures activity, some sort of activity, electrical activity or stress levels or anything like that, to give us feedback so that we can improve somewhere or another. All right. So let's give a feedback loop. All right. So first the person does the activity. Okay. And then it's measured on a device. And then after it's measured on a device, we can see or we can hear a sound. We see the bar graph going up high or going low. We can hear a low sound versus a high sound. Okay. Then this does what to my conscious level? It gives me feedback to be conscious to maybe try harder if it's muscle, or to relax more if we're dealing with stress. Okay. Over time, what are we trying to do with biofeedback over time? Get rid of it. So that's the goal. We're trying to get rid of it. And when is biofeedback most effective? When the body is most efficient. All right. Most efficient. Deficient. Okay.
Deficient.
Number 3. What patients should feel? What should patients feel from the biofeedback machine?
Nothing.
So when you work with them, just tell them you're not going to feel anything from this. We're just trying to see, maybe if you're doing some sort of muscular thing. We're just trying to see you, see how well you do while we look at the screen to see how much motion you have. Or it may make a noise. So you may try one on yourself so that they can hear a low sound versus a high sound, or a high bar graph versus a low bar graph. Okay. All right. We already talked about when is bio most effective. That was 5.
4.
Most.
What should they not feel?
Pain. Pain.
They shouldn't feel increased because we shouldn't be doing anything, except for just trying to get motion or relaxation or whatever. We talked about when it is most effective. And we talked about what does it measure? What are some things that biofeedback measures?
Blood pressure.
Blood pressure,
Heart
Heart
rate,
rate.
stress,
respiratory,
skin temperature, which relates to what? In many cases, skin temperature. Stress. Okay, good. All right, what are some types of patients or types of diagnoses that we can use it for?
MS.
Muscle weakness, give me a little bit more exact.
posture control,
Quad lag, maybe, anterior, a foot drop, maybe they have foot drop, something else.
no back pain,
Low back pain, something else. Gait, give me a little bit more. Posture, give me a little bit more with gait. Weight bearing. Okay.
Yeah.
Good.
In the foot, yeah.
In the foot, yeah. That's usually what weight bearing.
I hope so.
All right, Celia, how do we prep the skin? Prima stone, y'all. Prima stone.
Pink emery board.
And pink emery board. Not an emery board, but a pink one. If it's not pink, it's not effective. Hold on, before the saline gel. Can we shave?
Yes.
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 Yes, we can shave.
it's not medicine.
There's no.
Ionto, no. Yeah, but this, yeah.
It's
All right,
I'm missing it.
how do we measure the How do we prep it? We said the prep the skin. Yes, we do. Skin is, it's somewhat, I mean, it can be abrased a little bit because we're not, the electrode won't do anything to the body. I mean, we will hope that it's not causing any bleeding, but we're not as concerned as we would be for Ionto. All right, application method. So we're going to.
What you're saying is if that skin is needed or not needed?
You want intact skin, but you don't want it to the point where you've opened the area. But it may be abrased a little bit, which is okay.
I think they'll probably stop you before you.
Ow.
Okay, so we're going to clean the skin. We're going to use the pink emery board or the Primastone. We're going to wipe down the area first, of course, before we do that. We're going to put an electrode on, and then we're going to hook it to the machine. And then, of course, get the feedback that we want. All right, what type of electrode should be used? All right, that should be page 7. And it is a silver chloride electrode. Has a little silver disc in them. All right, and then what do we want to put on those silver discs?
Gel.
The gel for what type of conduction? Conduction. What is a thermistor? Temperature sensory. You read that? The temperature sensory element. Good. All right, and we use it for biofeedback to help us measure what?
Temperature.
Good. And we want to place it where? A little bit more circulation that rides down in that area. Good. All right, pelvic traction.
So middle finger?
Look. Yeah, it's the one here in the. I didn't want to do that.
You did. You already did. Right.
When you walk, there's more circulation that rides
this
right
one.
in that area. So it's the one after this one, but right here.
You already did
I'm not
it.
going to do that.
You already did it.
All right, pelvic traction. Yes.
That was the acupressure.
Yeah,
Yeah, for the
they're running together. They're running together. They run together. All right, pelvic traction. What is pelvic traction? Mechanical force that separates the lumbar region. Why did I say region? Why did I not say vertebrae? Because it could be muscular. Now, if I say what is static pelvic traction, then I might go further and say the vertebrae. If I'm saying intermittent pelvic traction, I'm really focusing on muscular. Okay, good. All right, so what should the patients feel? With a firm pull at the low back. Good. Now, I remember that page. I think it's lab. Some things to read. Page 28. Looking at the bottom, Roman number 2, A2 at the bottom. What he should feel. Okay. The first one talks about sensation should be a firm pull, but everything else after is no. No sudden, no sharp, no increase, no radiating, no numbness. So there's the no. So there's the what you should feel, what you shouldn't feel.
You don't leave out. Okay.
All right, treatment positions for pelvic traction. Usually,
It depends.
Fine and prone.
supine with a stool,
Prone.
prone,
Straight legs
supine, straight legs, no
with
stool.
HMP.
Right, okay. So, why would I do supine, straight legs, no stool?
Because
neutralizing
the HMP we're trying to
HMP, person has,
protrusion.
the HMP, and then we don't want them
The
to
gel to come out.
flex, and maybe for some reason they just don't feel comfortable on their stomach. Okay. So that HMP where we don't want to cause more flexion. The person can be supine, but don't put the legs up. If you do that, even though I know I'm gonna hit it later, but if you do that, it would be best to step in.
What should the patient not feel? Number 3.
So
Number
if
3,
you're
what
going to
should
do
they
the
not
person,
feel?
if you're going to do an
Number
HMP protocol, just make it real simple. If you're going to do
What
an
do they not
HMP protocol, have the
Don't know what
person
you should
step
not feel,
in,
what you should not feel.
be it prone or supine.
Are you writing it?
Yeah.
Can I see?
I know you remember it
Can I
for
see your
prone, but even for supine. So if the person is supine, because it's going to be hard to put that spreader bar on with the legs down if the person is supine. So it would be better if they stepped in, don't use the spreader bar and just use the hook and just grab it from the center. So in HMP protocol, if they are supine, put it on the regular way where the buckles will be in the front, but they need to step in. If they are prone, same thing, but step in.
Same process.
Okay, step in.
Do you
HMP.
always use the spreader bar for a
If you do, you're gonna run into the shins. If you don't step in. Okay.
And what I'm asking is the spreader bar, whether you have a breast person or patient or not, you use the spreader bar for HMP when you treat them in a supine neutral position.
If I put it on supine neutral and I don't step in,
Right?
the legs are going to really be in the way with that spreader bar in place, because this is where the hooks are here on the outside. So the legs are in a real bad position, or the spreader bar is really resting on top of the legs in this case, because you want to keep everything straight. Even with the angle, you want to keep it straight. So if the angle is straight down, then you're rubbing up against the shins. That's why if you step in, well, if you step in, you can just get the pull from the center with no spreader bar. Now, if you run into an issue where they're really blessed and it's going to really be a big, big problem, then maybe put some towels or something on the side to grab some of that digging in to compensate.
So you don't want to use the spreader bar.
It would be a good idea.
Got it.
Okay. Why should the knees be bent and be flexed in supine for non-compression diagnoses?
For relaxed,
So what we're doing to that
separate,
lordotic curve?
separating.
Yeah, because if I lay out straight, remember Miss Sonia talked about over there, you keep your legs straight and then try to sit up, and look at that arch that you put in your back with your legs straight as opposed to the curve that you put in your back when you keep your knees bent. You have a real big bucket handle that's, just really leaning way forward when those legs are straight. So when the person comes in and they lay their legs out straight, you see it and just say, ma'am, can you just bend your knees up like this here? It'll relax your back a little bit more. Because they don't know any better, but you should.
Relax.
Unless it's supposed to be H&P. Then you need to keep that. So keep that. All right. Pelvic traction effects.
To keep the
That's
vertebra in
lecture
good shape.
page
Straight
9.
shape.
So, distraction of vertebral bodies, that makes sense. For facet joint mobilization, that makes sense. Muscle relaxation, that makes sense. Reduction of pain, that makes sense. Okay?
No, big knife. Big knife. Big knife. Knife.
All right, so when is pelvic traction most effective? Kind of like a throwing out there. When the early stages of, especially HMP, before that, before it becomes calcified, yes. So early stages, definitely. Early stages of any sort of treatment, yes. And it's also most effective when the belts are on correctly, but it's most effective after we have warmed up the tissues.
That's the
Yeah, I mean, everything Dale said too. But when we have really warmed up the tissue, it's just another one. All right, MAPT. That's an in-house word or phrase. Mode,
Angle.
angle,
Time.
Good, just in-house. It's in-house. All right, angle of traction and bed types. All right, first of all, the angle is normally between 0 to 10. However, if I'm working on this bed here, okay, I should probably, after getting the patient on the bed, so if I want the angle on this bed here, raising this up and down doesn't do anything to the bed, okay? So I want to make sure, if for some reason we have the bed way up high for a reason, you know, sometimes we do things on purpose in practice because we want to see if people are thinking. Why would you make a person scoot up on the bed when all you have to do is lower it down? All right, so if it's too high, then lower it down. But then after you have lowered it down and got some things in place, raise it back up for what?
The angle.
Raise the bed back up for what?
For you.
For you, for your back, for body mechanics. Because when I raise up the bed, what does that do to the angle? Nothing. Nothing. So after I raise the bed is being raised for me, and then I can fix the angle. Over here. Lower the bed so that the patient can get on. Fix whatever I need to fix. But don't fix it where the bed is this low, and then you tighten everything down here. Or don't raise the bed up to the height that it needs to be angle-wise, and you're not tightening, you haven't finished tightening what you need to tighten. But after you have connected everything, don't forget to fix the angle before you do the pull. But fix the angle after they have gotten on the bed. Yeah. What is the maximum percentage of pounds that could be used with traction? Go to a lecture section.
More down.
That's 40 to 50. 40 to 50%.
Page 9. Looking at 4.3. Weight. Minimum weight, half the body weight. To separate the vertebrae, first treatment, 40 to 50% of the body weight. We're going to stick with 50 for this time. Increase to 50% within the first treatment. 2 treatments. We're going to stick with first treatment if it's the static protocol. Up to 80% of the body weight that's needed. So you have a patient who is 200 pounds. What is the maximum percentage that it's known that we can give to this patient who is 200 pounds? 160. Okay. So saying that would mean that 160 is 80% of 200. Okay, good. All right. How are we doing? Half an hour, not too bad. All right, belt placement. So we know that the pelvic belt should be over the iliac crest. Which belt should be tightest? Top should be the tightest, and the strap should go along the tissue tuberosity. Good. If I have the thoracic belt on, I'm going to put it on the ribs 8, 9, and 10. Which belt should be the tightest?
The
bottom belt. The top belt should be sitting
Below
the
xiphoid process. The strap should be over
the acromion.
The acromion level. Good. I need to put a towel
For
for
pinching.
pinching purposes. All right, good.
Sir, realize I'm answering the questions now.
Huh?
Realize that I'm answering questions now, so when anxiety takes me.
Yeah, man.
I got it on tape too. I have to get it from both.
Thank you.
Yeah. All right, stepping in or not stepping in belts. We talked about that. How does progressive intermittent and or progressive static traction visually look? All right, visually. That is good.
Actually, he said no.
Oh, you said no, that day.
No, try. Oh my God.
All right, 3 steps take it 4 steps. This would be intermittent. 4 steps intermittent. On, off. On, off. On, off. On. And then everything else thereafter. If this was 0 pounds. Step 1, 2.
That's 3.
That's 3. One more. Okay. 1, 2, 3, 4. Okay. Now, if we set a minimum pound, which would be what percent? 50? 50%? All right, so let's say that this is, let's say it's 80. Let's say this is 80 pounds, for example. Then, okay, so it's going up, down, up, then, what? Wait. What do you mean wait?
Is this intermittent?
Yes. Okay.
No,
So-
we don't increase the pound in the session.
We're not increasing pounds. We're just doing our steps. All right, so it's coming back down to the 50%, which is 40 pounds. Went back down initially because it couldn't come back down to 40. And it went up, back down to 40, up, back down to 40, up, back down to 40, up, back down to 40. This will be the minimum pound. This is the maximum pound. That is intermittent. Static is,
Wait. So we think this is 0, 20, 40, and 80? No, it's just an example. So the first time you went from 0
I don't have it
to
in the
20.
exact spot, but I'm just trying to show you 4 steps. But go ahead.
So you went from 0 to 20, come back down.
0 to something.
Yeah, I was
Yeah, yeah.
guessing. And 0 to 40, back down. And up.
Maybe this is 60.
Okay, 60,
Uh-huh.
and just came back to 40.
Because now it can come to 40.
Oh, okay.
Yeah, and then it's going to go 80, 40, 80, 40.
Why?
Because we set a minimum pound. We don't want the person to come all the way back down to 0. Yeah, minimum pound. All right, so that's intermittent visually.
That,
Go ahead.
up and down is the off cycle.
Yeah. So this is, now it's still holding something,
Right.
but it's not
Technically.
as much. Yeah, because the real
So-
stretch is here.
So why didn't you hold anything for the first two?
Because you couldn't come back down to the minimum pounds that you set because it didn't exist. It didn't exist until it got above 40. Yeah. All right, so if we did static, second step, third step. So first, second, third, 4 thereafter. And of course you'll have that down there.
On the first drawing, it should, instead of coming to a peak, wouldn't it plateau and it's going to hold for a certain amount of time?
This one?
No. The first drawing.
Here.
It doesn't go up to 20 and then drop back down. It goes up and then holds for a certain
Okay,
amount.
I can put hold, what did I say, 40 seconds. I can write that in, but yeah, I can write that in. And then your 10 second hold. That will be for each one. Now, prone traction produces more of an anterior or posterior push.
Anterior.
Anterior, good. So right here is where the pull is going to happen. So if I'm laying on my stomach, let's say, and it pulls, it's going to pull me into more of what?
Extension.
Extension. Good. That's what I want. should the table be locked or unlocked? I'm sorry, unlocked or locked? Let's go unlocked first. Unlock is still dependent on something else.
Static.
Static, wait a minute. Okay, so let's go with static first.
Before you press start.
Before I start the machine. Why do I want to do it before I start the machine? There's no other rest time that it could happen. Okay. And then if it's intermittent, when do I want to unlock the table?
Rest time of
The rest after the
Max
max 4, whatever it is. Step 4, step 5, step 2, step 3. After that, on the rest.
But this can only be done if you have a slide table.
All right, when should I lock the table?
At the end of the, when the machine,
When the machine is off. Before the patient gets up.
Right, but before I do what?
before you take the patient
Before
out,
you take the
allow
patient out.
to get out.
Right, because as long as everything is pulling from that end and pulling from that end and the belts are nice and tight, they can't really move anywhere. But if you unhook here and you have not locked the bed, you're putting them at a great disadvantage if they start to move. So don't hook, even though they're trying to breathe because it's hard, off, lock, and then you can do what you want after that. What does the patient feel with a split table? All right, I'm pulling 80 pounds. I pulled that max of 80 pounds. I'm going to the rest, for example, 40. I split the table. It's pulling at 80 pounds again. What's going on? More pulling, but is it more pound? All right, so why does it feel like more pull? Less friction. So less friction. So it feels like more even though it isn't more. How do you help the patient on and off the bed?
Lowering the table.
All right, so lower the, that's beautiful. Lower the table so they don't have to jump off, first. So if the patient is supine, help them with the legs, stool down. If they can scoot over to the other side first, log roll, and help them. So if you're going to play patient tomorrow or Wednesday, play a real good patient so that they can help you. All right. If the person is prone,
You slide out.
yeah. So
on your
unhook
chest.
the belts after you lock the table. Unhook the belts. Then let them slide the legs to the floor. Let the belts drop out. You can go ahead and step up. Okay. What exercises can be done?
Low back pain.
This was 4:30 this morning. So. Yeah, because this was 4:30 this morning.
Low patient.
Low-level paraplegic.
Yeah, low-level paraplegic with pelvic traction. Yeah, what exercise can you do with a patient, period? All right, so let's say... Jesus, what is that? Patient has, let's say, H&P. It is their first time after traction. Where will you start? So they first time.
Static prone?
Prone lying.
No.
Prone lying. What is this producing? Just laying there. Just getting a good stretch. That's there. Okay. How can we push that to go further? Put on the elbow, maybe get a stretch. You can probably put a pillow or something underneath to get a static stretch. Anything else that you can do as you're progressing the person?
Standing extension.
Too far. Don't go that far yet.
Pelvic.
Yeah, don't go that far yet.
In prone.
If you did the ball, glute sets. I'm coming coming back to the ball. I like the glute sets. What would the glute sets do? I'm in prone.
Pelvic,
I'm in prone.
Abdominal speed.
What is the glute sets going to do?
It's going to strengthen your glutes.
If I do a glute set, I'm going to do what?
You're going to flex your...
I'm going to...
You strengthen your glutes.
Is this on video? So as I'm squeezing the glutes together, I'm getting more
Anterior
extension. I'm getting more extension. All right, then we can progress. Now you said something about a ball. All right, let's talk about the ball. What can we do on the ball?
Four.
in prone?
Oh, I don't know. I'm just. We talking about with this patient.
You said
Can we
prone.
do anything with the ball? Should we do anything with the ball? What is that?
No, not in prone.
You can do
How much? How much
extension.
You can't do it in prone because you don't want any flexion.
Can you
It's
do something with the
HMP.
ball?
You can do postural exercises on the ball, sitting on the ball.
What is
You
it?
can sit on the ball, do some posture.
But not in prone.
Anything over the ball? You said this way. You can stretch this way
With the ball.
on the ball. All right. So just be careful as to where you take the person initially, and then have some sort of progression. The key thing is you can do a lot of things with a back patient. Just make sure it's not a contra, and just make sure you're not saying, "Can you lift the table up?" I mean, first, can they just lift up the phone first? Let them pick up the phone. Don't have them pick up the table first. Just progressive. Progressive.
Can you do hip extension?
Extension. What kind of extension?
Hip extension.
Hip extension. You'll get that pelvis to come back.
That
You
would
have to do it on both
be
sides.
standing.
You get that pelvis to come back. What if you had just low back pain?
Line.
What exercise could you do?
On prone.
Pelvic tilt. Yeah. What else? Before we go to bridging. Maybe single knee to chest. Maybe double knee to chest. Not to say it's wrong, but we want to
Progress.
progressive. Hold off on 18. I'm coming back to 18. I'm coming back. That's going to take some time. All right. Acupressure was created by who? What type of medicine?
Chinese Asian.
Chinese Asian. Good. Qi means
Energy.
Acus means
Needle.
Good. What is a meridian?
It's imaginary line.
Imaginary line, channel,
Would you give us a chance?
pathway. Good.
Oh my gosh.
How many meridians are there in the body?
12.
14.
14.
Equal pairs, and then two unpaired pairs. What's in the front?
The lo-
Oh yeah.
Governing. No, that's in the.
Anterior is the conception.
Conception. What, sir, would you try to say?
CG?
Conception.
Is it the CG? CG.
conception
And what about yin yang?
governing.
What about yin yang? What about yin yang? Is one of them yin, one of them yang?
Yin back.
Which one is yin, which one is yang? Yin yang. CG.
CG.
Male, female. Where are we?
Male in the back.
Female in the-
Female in the back.
Male in the... Ooh. Keep your eyes on the paper. Keep your eyes on the paper. Where the meridians originate.
From organs. In
Body organs. What do you mean? In the organs of the body.
You ain't giving us no chance to answer the questions.
What are the functions of the meridian? Transfer energy.
I just relate that something.
Relate something going on inside. That's why I'm having this problem right here. Oh yeah. But also I can do what now?
stimulate.
PT
Can
wise.
stimulate.
Ring
I
stimulates.
can stimulate that
stimulates.
same area to treat
So,
on the inside. Good.
Alright, you can take it back now. Answer two.
How long does it take for blood to circulate through the body?
24. 24 hours.
So it go and it stays in these meridians within what?
2 hours.
Yeah, 2 hour time frame. What are the two fingers preferred to use for acupressure?
The thumb and the middle
On the
finger.
middle.
The thumb and the middle finger.
That works.
Okay, acupressure contras. That's in that reading. What's the acupressure contras?
Oh, I think I've read that before.
You think I've read it before?
No, I've
It's in the lecture. It's in the lecture. It's in the reading.
Scar tissue. Oh, yes.
I have it here.
Cardiac condition.
16, yes,
Oh my God.
16.
Management, scar tissue. Cedric, talk now.
He doesn't know this one.
Celia. Cedric, go.
I don't know this one.
Uh-huh.
This one is new.
What about you, Oga?
Continue.